About 90% of cancer patients in the US now use traditional, complementary and alternative medicines, or TCAM therapies, as they increase a person's quality of life, enhance conventional treatments and are fast becoming mainstream protocol. We spoke to Dr. Daniel Weber, who's been practicing TCAM for over 35 years, about his extensive work bridging the gap between Eastern and Western medicine. Dr. Weber, welcome to Free Talk on Free Spirit.
Thank you. It's good to be here.
Now, you've been practicing what is now called traditional complementary alternative medicine for 35 years. In a nutshell, can you tell us exactly what TCAM is?
TCAM stands for Traditional Complementary Alternative Medicine, as you said. Traditional medicine are those medicines from cultures like India and China that have had a long development of a more scientific-based medicine based on their own traditions. Complementary medicine is those things that have often derived from naturopathic medicine, originally from Europe and Germany in the 19th century. Alternative medicine is a term that's not used today a lot. We prefer, I think, integrative. That is, the bringing together of this with orthodox medicine so that there is a sense of we're working together in this. And this has been a change that has occurred over the last 35 years.
Now, tell us a bit about your journey, your studies, and what led you to focus your work in this particular area.
I think, like many of these things, it begins with a personal challenge. My sister's child died, and I was just beginning to do my studies in Oriental medicine, and I felt that I could have offered more, and I just didn't have the skills. And so I then embarked on this journey because of this, because I wanted to actually be able to help people, and I felt there was something there. And that took me, of course, to England, where I did a bachelor's degree in acupuncture, then on to Japan, where I studied with a number of doctors, and finally into China.
Do you think the perception of natural and complementary and alternative medicines in the world is changing?
Oh, absolutely. I think there's been quite a change in the environment, recognizing in the end it's about what works for the patient. And in China, the hospitals have both traditional and orthodox medicine together, and a patient is referred to the appropriate department for treatment rather than there being any competition between the two of these.
In your words, how would you describe cancer, or what cancer is?
I don't say cancer is a disease, because mostly what we consider a disease are those factors that are associated with the immune system fighting off pathogens. And in fact, cancer is probably more like HIV, which is a breakdown of the immune system. So cancer is a condition that is enormously complex. There are over 600 different kinds of cancer. Each patient has a different presentation of a cancer. So each person's cancer is unique to themselves. It takes 30 years for many tumors to develop, and it takes hundreds of insults to the cells to actually initiate. You just don't get one thing that occurs.
Daniel, how can traditional complementary alternative medicines help cancer patients?
Well, I think in a number of fashions. First of all, when we're talking about complementary medicine, we're talking about not a substitute for orthodox treatment. So, for example, with radiotherapy, there are compounds that actually protect parts of the body from the effects of radiotherapy, particularly in breast cancer, talking about protecting the heart. There are compounds that actually help with chemotherapy. They allow reduced dosages of chemotherapy, but at the same efficacy. And lastly, they deal a lot with the side effects. They can reduce nausea, they can reduce ulcerations and so forth. So complementary medicine has a very important role to support orthodox interventions.